Hey everyone, this is Jason from Intricate Art Spine and Body Solutions. You can check us out at intricateartseminars.com. If you're watching this on YouTube, you know where to find us. You can check out our blog page on the website. I've got about 100 articles up there about dry needling and joint manipulation, how to regulate the autonomic nervous system to improve overall health. So today I wanted to talk to everybody about neuropathy. So in the last 3 years, I have never in my life, as both a high-level athlete, I played Division I hockey in college, and as a doctor, I've been a doctor of physical therapy for about 10 years, I have never ever seen so many horrific cases of idiopathic neuropathy, including tinnitus, hearing loss, burning in the tongue, eyeball pain, headaches, incontinence, erectile dysfunction. All of that is neuropathy, right? It's all being caused by a dysfunction of the nervous system. I'm not going to go into specifics about why I specifically think that that's happening, because I would like people to see this video on YouTube. But let's just say that if you had something injected into your body within the last couple years that you had never had injected before, and you all of a sudden have these widespread or specific horrible problems going on with your body, and you didn't change anything else about your life except for that one thing, that's what's causing your problem. So the issue that I've seen, and this is so sad, you guys, I see young patients every single day that have horrible neuropathic conditions going on, like burning in the arms, again in the tongue, in the genitals, all over the place, for no apparent reason. So remember, idiopathic just means of an unknown origin in medicine, more or less. So a patient that I just had in yesterday got an injection of something or other about 2.5 years ago, and since day one after that, and she's a 30-year-old female, since day one after that, she's had horrible, debilitating neuropathy in her neck, in her ears, and in her right upper extremity ever since then, and absolutely nothing has helped her. I treated her yesterday, and in one treatment, I was able to almost completely resolve her neuropathic symptoms. Now, how is that possible? Well, I see this happen all the time with tinnitus, hearing loss. Again, if there's no underlying structural damage and you just kind of randomly acquired these conditions, there's no reason that you should be like that, technically. People's body don't cause neuropathic problems like that randomly, right? There has to be something that is overloading the autonomic nervous system, sucking energy away from the autonomic nervous system, which is forcing our body and our brain into a state of energy crisis where it's run out of sufficient energy to do everything it needs at the same time. So then subconsciously, our brain and our body has to choose where to utilize the energy, and it can't use enough in enough places. So the underlying problem, if you're having one of these conditions, including fibromyalgia, anything like that, is your sympathetic autonomic nervous system has been pushed up the hill and over the edge, and now it's going down the hill on the opposite side on like a runaway snowball effect, runaway train, where your body has gone into enough of an energy deficit where it is so poorly functioning as far as being able to utilize and produce enough energy to properly function that all sorts of things get degraded and start to happen, including our nerve health, right? So nerves need blood just like everything else. Just like muscles, can get hypoxic with decreased blood flow. Nerves get hypoxic too, right? So we know that when nerves get hypoxic, their resting electric potential changes, the conduction velocity goes down, our myelin starts to degrade, the amount of insulation that we have for our saltatory conduction and our myelin coating of the nerves, that starts to get thinner. So think about if you were trying to protect yourself from lightning, right, and you were out in a lightning storm. If you were lying on the ground with a 1-inch rubber mat on top and below you, would that be better than protecting yourself with lightning than having a 5-inch mat of rubber above and below you? Well, the answer is the more rubber you have, the more electricity you're protected from. That's exactly what's going on with our myelin sheaths in our body that coat our nerves, right? So lots of things can degrade myelin. Hormone dysregulation, neuromodulator dysregulation, high or low levels of estrogen, all sorts of stuff like that. The problem with idiopathic neuropathies, which is what fibromyalgia is, and all of these new cases of neuropathy that are apparently not happening, is that your body has received a massive insult in the case of the injection that I'm referencing to, or it has acquired enough overall insult over time where our nervous system, our sympathetic autonomic nervous system, has been pushed so high that it's lost its ability to find its way back home to homeostasis, right? So when needling is the only direct tissue treatment in the body that we have, there's no other direct tissue treatment that physical therapists have aside from the skin and the mucosa to treat the muscles. Without direct soft tissue stimulation, you don't get enough stimulation of the corresponding brain area to wake it back up. So the way that I think about this, and nobody is 100% sure how this works, but I think this is more or less correct, and this is an easy way to think about it, is that you receive, let's just say you either got an injection or you got into a car accident, it doesn't really matter. The amount of insult that you receive, if that pushes your nervous system too far over the edge, it basically like gets lost in no man's land and it can't find its way back to the point where it can self-regulate. So I think of it sort of like Hansel and Gretel, right? The breadcrumb story. So every tiny little piece of steel or every needle that we place in the body is a direct enough stimulation where it's like leaving a breadcrumb in the brain. So the more pathologic body areas that we treat, the more breadcrumbs we leave down for the brain to find its way back to homeostasis. That's one way to think about it. Another way to think about it is with enough of an insult, like if you get seriously injured, which those injections are doing to you, that's a serious injury because it's forcing your body to do something it was never supposed to do. Your body is now using so much energy on that specific thing that it runs out of energy to do everything else properly, right? So your brain kind of like, certain areas of your brain will either become dysfunctional or they basically like sort of shut down and turn off to provide energy for other things. And if that's let go, or if that is let to sit like that long enough, it can be very, very hard to recover that ability to regulate your own autonomic nervous system. The sicker you are and the more out of shape and the more unhealthy you are, when you get an injury like that, the more likely it is for your autonomic nervous system to go that way. So we know for a fact that about 70% of the United States population is deficient in vitamin D. A huge percentage of the population has high blood pressure. About 70% of the population is also either obese, overweight, or morbidly obese. So right there, that puts about 70% of the United States population in the poor health category. If your health is poor to start with, it doesn't take that much of an insult to push your nervous system over the edge where you're basically done for. That's why about 50% of 50% of 65-year-olds that break their hip die within 5 years. That has nothing to do with the hip itself. Breaking your hip typically is not a life-threatening injury. Like, I shattered my hip 20 years ago and I have absolutely zero problems with it because I was healthy when it happened and my body was able to recover. And I take care of myself well, right? I exercise, I eat well, I needle myself all the time. If you don't do those things and you get an insult like that, which is the case with the vast majority of people, that is enough to push your autonomic nervous system over the edge where it never finds its way back. It loses the path, it starts wandering around, and it can never find its way back to home, to homeostasis. Needling is, again, it is a direct enough stimulus that overall causes nervous system homeostasis in the brain and in the body. Right? So if the person is healthy, like the patient that I mentioned that I had yesterday, there's no specific reason that their body should be like that. What's happened is the response to the initial injury was so severe that your body got so inflamed, your sympathetics went up so high, you got so many pro-inflammatory markers floating around in your lungs and elsewhere in your body. Fibromyalgia could be anywhere. So you get tissue hypoxia. Oxygen is what your body needs to function. One of the things it needs to function. If you have hypoxic tissues, nothing is going to work well. That includes hypoxia in the brain and in the body. And hypoxia in the body causes hypoxia in the brain. Hypoxia in the brain causes hypoxia in the body. They're intricately interconnected things, the brain and the body, that we can't separate. So obviously, I'm not going to go sticking needles into people's brains, right? That wouldn't be too good. So what we can do is by directly stimulating pathologic neuropathic tissues in the body, which like kicking the brain in the head and saying, yo, wake up to this stuff, or stop disregarding this stuff. So the overall effect of dry needling is sympathetic autonomic depression and parasympathetic autonomic elevation, which is exactly the way we need to push the nervous system to recover people from almost any medical impairment. Remember, the overall process that our body that goes through when it gets aggravated, both mentally and physically, is to elevate sympathetics, which reciprocally inhibits parasympathetics, which inhibit our brain's ability to tell what's going on with our organs. And remember, our organs provide a huge amount of immune system function. So when the sympathetics go up, our healing ability goes down, our immune system function goes down, everything gets dysregulated. So we get more like interleukin 1, interleukin 6, tumor necrosis factor alpha, C-reactive protein, CRP. We get less positive healing aspects like interleukin 10, which is anti-inflammatory. The NRF2 pathway, which is an anti-inflammatory pathway, gets shut down. So our anti-inflammatory processes get turned off, and our pro-inflammatory markers get really highly concentrated throughout the body. Inflammation is only good for a very, very short period of time, like a day to 3 days potentially. After that, the blood becomes hypoxic, it gets sticky, gets filled with nasty proteins and pain-amplifying chemicals, and it just leads to this detrimental snowball effect where things hurt, things get more hypoxic, more inflammation happens, stuff gets stuck together, nerves lose blood, they become hypoxic, and they start misfiring. This is what causes the vast majority of idiopathic neuropathy, which a huge percentage of the world is suffering from right now. The reason that dry needling can so quickly and effectively reverse that when other medical treatments don't is that other medical treatments are treating the neuropathy, they're not treating the nervous system. So when people have neuropathy, you get things like gabapentin, which is a painkiller basically, right? Or muscle relaxers. The problem is not your muscles that the muscle relaxers are working on. The problem is your overall nervous system is in sympathetic hyperactivity, which causes widespread muscle contraction, widespread hypoxia, a lot of pro-inflammatory markers throughout the body. So by needling pathologic tissues and specifically targeting the parasympathetic portion of the autonomic nervous system, we can significantly induce autonomic nervous system homeostasis where it hasn't been there before, right? So again, it's like leaving breadcrumbs in your brain for it to find its way back to homeostasis or home. I think this is an extremely important thing for the United States population and the world population to be aware of right now, because so many people have become hesitant to go to the regular doctor, and you should be, because I think most modern medicine is complete crap, right? There's certainly some good pharmaceuticals out there, and there's certainly some good stuff that we've done in modern medicine, but if you think it's good, explain to me why our population is sicker than it ever has been before in the past, right? There's a ton of reasons for this. We've touched on a couple of them already, right? So if your body is working too hard to take care of things that shouldn't be there or that aren't normally there, it loses its ability and energy to do everything else. So by dry needling, we can push the autonomic nervous system back to the point where it can self-regulate again, right? So if you depress the sympathetics enough, everybody's got a certain individual threshold where if they go over that, they're not going to recover unless something specific is done directly to the nervous system itself. This does not mean treating the symptoms. This means treating the nervous system, which is the reason you're having the problem in the first place. So if you can go and reduce as much pathology throughout the body as possible, that depresses sympathetic activity. If we can at the same time stimulate the parasympathetic part of the autonomic nervous system, which would be the pelvic floor muscles, the sacral plexus, S2 to S4, the concha of the ear, the symbiconcha of the ear, the inside of the tragus, the trigeminal nerve in the jaw, and the upper cervical spine for cranial nerves 5, 7, 9, and 10, the vagus nerve number 10, we can significantly push the autonomic nervous system towards homeostasis, and we allow the brain and the body to heal itself. This is key. Needling is not putting anything external, is not using a medicine to fix symptoms of the problem. Needling, when used properly, is treating the autonomic nervous system itself, which removes the inhibition that is stopping our body from functioning well, right? If you've never had neuropathy in the past and you got some medicine and now you have neuropathy, right? The problem is not your body. The problem is the medicine, and if you're not taking the medicine anymore, it's the same thing that happens with people that die within 5 years of breaking their hip. Once the hip is broken, the hip is no longer the problem. It's the initial insult of the injury that sends the nervous system over the edge, and if you're not in good health, it can never find its way back home. So needling opens up brain pathways, two different parts of the body. It improves blood flow in the brain, it reduces spontaneous electrical hyperactivity, and it helps nerves and muscles function better. So remember, when the sympathetics go up, our body gets more hypoxic, so less oxygen, more carbon dioxide. With more carbon dioxide in our bloodstream, remember our blood is very, very sensitive to pH, right? If it, like somewhere, depending on the person, 7.2 to 7.4, a lot of the time, if you just go up 0.1 or go down 0.1 from your baseline, you're going to have massive problems. Your enzymes are going to start to get degraded. Protein synthesis doesn't happen when the cells are more acidic, right? So more sympathetic hyperactivity makes our cells more acidic. So if we're talking about musculoskeletal cells or skeletal muscle cells, the resting potential of a healthy skeletal muscle cell in general is about negative 35 millivolts. To get it to fire, it needs to get more negative to negative 70 millivolts. If you're in chronic sympathetic hyperactivity, which is sympathetic hyperactivity for more than 3 days or a day, definitely more than 3 days, our tissues become hypoxic, so our cells are living at a more negative state. So instead of living at negative 35, they're living at negative 40 or negative 45. And to fire, instead of needing to get to negative 70, they just need to get to like negative 60 millivolts or so. So the cells are more negative to start with, and they need to cross less electrical threshold to fire, which is what causes muscle spasms and neuropathy, right? On top of that, when the sympathetics go up, our body loses its ability to methylate vitamins, methylate nutrients. Our DNA gets more methylated or broken down, which is not good. We get more DNA misreading. So regardless of the reason, even if you did have a specific injury in the past, if that injury is not a consistent injury and you're no longer taking, if a medicine caused it, if you're no longer taking that medicine and your body is still acting this way, the problem is that it's lost its way to get back to homeostasis. Needling is the most powerful non-pharmacologic tool that I know of to push the body towards homeostasis in the physical therapy setting. If I had to pick the #1 best ways to improve autonomic nervous system homeostasis, eating well, exercising, and sleeping well are 3 of the most important. We know people that do that well on average live about 14 average extra healthy years than somebody who doesn't. The problem with that stuff is most people don't do that. So another way that we can push the autonomic nervous system towards homeostasis is removing as much tissue pathology from the body as possible. We don't specifically need to think about treating the neuropathy itself. So let's say, like my patient the other day, she had right upper extremity neuropathy. I didn't just treat her right upper extremity. The first time I treated her, I just treated her neck and her right upper extremity got better. The right upper extremity in this instance is not the problem. It's just where the symptoms are presenting. So it's a mistake to just treat the right upper extremity. If you got people with neuropathy, you need to think about it, especially if it's idiopathic. If there's no specific reason or no continued insult that's causing it, the problem is the nervous system, and the nervous system can present with neuropathy anywhere in the body based on an individual basis. So you need to treat the entire body. Again, the way to think about this is, if it's idiopathic neuropathy, you need to put as much energy back into the autonomic nervous system as you can to bring it down to the threshold to help it find its way back to the path towards homeostasis. If you can't do that, the nervous system is not going to change. So just because you theoretically would treat just the right upper extremity, that may not push the autonomic nervous system to enough homeostasis to heal itself. So we need to remove as much pathology throughout the body. Every little millimeter of pathologic tissue sucks energy away from the nervous system. Every bit of pathologic tissue that we can normalize via needling it, which sends a stimulus to the brain, and then the brain sends a return stimulus back, which actually makes the major changes. If we can put enough energy back into the nervous system, our body basically remembers its ability to function properly, and it begins to do so. It seems overly simple, but it's really simple as that in a huge percentage of the cases. So if anybody out there is suffering from fibromyalgia, medicine-induced neuropathy, which is very widespread now, any type of diabetic neuropathy, if you can supplement your body with the proper supplements and remove as much tissue pathology from the body as you can while specifically stimulating the parasympathetic part of the autonomic nervous system, we push the body to a state where it can fix itself. We don't specifically need to look at fixing certain pathways, which is why so many of these neuropathy cases that I'm seeing are resistant to medicine. The nerves themselves are not technically the problem. It's the nervous systems that are the problem, and dry needling, especially when you combine it with joint manipulation, is the most effective way to push the nervous system, the autonomic nervous system, towards homeostasis. As far as the manipulation goes, if we're thinking about areas that can really disrupt autonomic nervous system homeostasis, anywhere in the spine can, but if the upper cervical spine is off, that's a bad one. Anywhere in the spine, our sympathetic chain goes from C7, T1 down to the lumbar spine. Let's just say a lumbar vertebrae is rotated. If that's aggravated and a lumbar vertebrae is rotated, the sympathetic chain gets aggravated, that gets pulled on, the trigeminal cervical complex gets pissed off, the hypothalamic pituitary adrenal axis gets aggravated. The gut-brain axis gets disrupted because the vagus nerve starts being inhibited because it's so parasympathetic. So the more sympathetics get hyperactive, the most inhibited structures in the body are going to be the most parasympathetic structures, which the vagus nerve is the most parasympathetic structure in our body. So I think in modern medicine, you guys, it's like stepping over a penny. Sorry, it's like stepping over a $100 bill to pick up a penny, right? Just because it doesn't seem very complicated and it's not using some super fancy new medicine or whatever, people tend to overlook the simple facts of health. Again, if all you did was eat well, sleep well, and exercise on a consistent lifelong basis, you're going to live 14 average extra healthy years. If you've started to develop abnormal neuropathy that you've not experienced before and that shouldn't be there, the problem is that your autonomic nervous system is lost. And again, the best way that physical therapists can help with that is by recommending certain supplements and by specifically treating the autonomic nervous system itself by depressing sympathetics and elevating parasympathetics. Let me know if anybody has any questions about anything. Check us out at intricateartseminars.com.